of the Supreme Court of Kenya, the distinguished judges of the Supreme Court, Court of Appeal, High Court, magistrates, all protocols observed, delegates, ladies and gentlemen, good morning. My name, as you have heard, is Jane Maina. I'm the Executive Director of TIKAH. In full, it stands for Trust for Indigenous Culture and Health. For the last over 20 years now, we are 22 years, our organization, we have had one belief, that everyone has the right to the highest standard of health. And because we work on health, and especially on, when we say indigenous health, it includes our herbs and foods that contribute to health. And we have worked with communities and the Ministry of Health to see that this belief comes to a reality. The way we do this is by doing community trainings, by doing advocacy for laws and policies, by strengthening health systems to ensure that especially the marginalized communities can access health. We know sometimes, because a lot of the times health is privatized, people with money are able to afford healthcare, but sometimes in low-income communities, in rural areas, the right to health is not attained or is not accessed in the same way. So our work includes to amplify these community voices, to ensure that the systems of health address the needs of our communities, and to ensure that we promote dignity and well-being for all, as I say, particularly the most marginalized. So today we are very excited to join you because we recognize that undeniably the judiciary plays a critical role in shaping the nation's health outcomes. You do this by the interpretation and application of the law. The judiciary is the one that guards the right to life, the right to health, and dignity, which are the core tenets of our Constitution, and most important, the Sustainable Development Goal number 3, good health and well-being. By ensuring access to justice, the courts do more than just resolve disputes. They affirm human dignity. They hold institutions of health or other institutions accountable. You breathe life into the promise that is justice in health in our Constitution. Yet, we face sobering realities. One of the health aspects that TIKAH works on is maternal health. And the thing is, in Kenya, if I was to just share one statistic, 355 out of 100,000 live births end up in death. This is extremely high. Every year, 7,000 women in Kenya die of maternal-related issues. They die when they're pregnant, when they're giving birth, or shortly after they've given birth. Maybe to give an example, or bringing this statistic a little lower, 7,000 out of 365 days, it means every day there's 19 women who die. That means every hour there's a woman dying. If you were to say it like in a motor vehicle accident, this is like a minibus that crashes every day and kills all passengers, including the driver, including Makanga. If there was a sport like that in Kenya, we would call it a dark spot or a black spot, right? There would be concerted effort to ensure that that sport is no longer a dark spot. There'd be conversations about widening the road, there'd be conversations about dual carriage, there'd be conversations on how we end those deaths. Somehow, in maternal mortality, we have not made the decision that these lives are worth saving. Some time back, there was a famous doctor, he was a FIGO president, Dr. Mahmoud Fatala, the president of FIGO Forma, he said that women are not dying of diseases that we do not know how to treat. They are dying because societies are yet to make the decision that their lives are worth saving. We at TIKAH, we say that no woman should have to die while bringing forth life. These statistics are not just statistics. They represent a mother, they represent a family, they represent a community that's in grief. And this must concern all of us. We know that these causes of death are not purely medical. They are deeply structural, they are social, and sometimes they are legal. It speaks to the inequalities in access to health. It speaks to the failures to accountability or to the denial of fundamental rights. Over the years, the judiciary officers have been instrumental in challenging these injustices by promoting accountability in state agencies and interpreting the law with compassion and foresight and shaping progressive jurisprudence that upholds the right to health. Today, we look to you, judges and magistrates of Kenya, as champions of the Constitution, especially the promise of Article 43 that guarantees all of us the right to the highest attainable standard of health, including reproductive health. So your judgments have power to transform policy, to affirm our dignity, and to ensure that no Kenyan is left behind in their pursuit for health and rights. So we hope by the end of the day today, my colleagues and the things that they hope to share with you, you are able to leave here with a renewed commitment and a resolve to strengthen the bridge between justice and health. May we continue to believe that women's lives are worth saving and that we may build that society together and do everything that we can do to save those lives. Asanteni sana.